Hello, everyone. My name is Mark Anthony with Edge on Regenerative Medicine. I'm really excited today. We get to talk with Andrew Paulson, and I'm excited because we get to learn what a nurse practitioner is. There's a lot of people out there that are wondering what is that, and then they end up meeting nurse practitioners when they see stem cell doctors or they go to a stem cell seminar and things like that. And I think that today's going to be a good question and answer on getting to know what a nurse practitioner is, what a nurse practitioner does. And so I'm really excited to introduce Andrew Paulson. Thank you so much for being on the show.
Thanks a lot for having me, Mark. Glad to be here. Excited.
No, I'm excited too. It's really cool because we interview a lot of doctors on the show.
Right.
And I'm always hearing nurse practitioner. And I'm like, I need to meet a nurse practitioner. I mean, it almost seems like the nurse practitioner in my eyes does almost everything. So,
right.
I don't want to say that, put words in your mouth or somebody else's mouth. But, today we just want to talk about basically what does a nurse practitioner do. I know that you're working in regenerative medicine by helping people with the healing process in their body. And I know, first of all, I don't want to leave this out, but I know that you work with Optimum Regenerative Care.
Correct.
And tell us a little bit about Optimum Regenerative Care, where that's located, and how long you've been with them, or how long you've been in the industry.
Okay. Optimum Regenerative Care is in Bethel, Connecticut, right on the Danbury border. We also pretty close to Westchester County, New York. So we attract a lot of people from that area, as well as all the way up to from Hartford. Even we had some people come from right on the border of Connecticut and Massachusetts. So pretty wide area. Most of Fairfield County we cover. My journey is a little unique in that I started out working in orthopedics and learned a lot of different joint injections, and took that, kind of expanded on that. And instead of, injecting steroids and hyaluronic acid and things that are okay temporarily, I decided to get into more regenerative medicine injections, PRP and stem cells. And we're going to get more into that later on, but started to do that and just saw the outcomes were just so much better with that stuff compared to the traditional steroid injection. So I've been doing these types of injections for the past 5 years, and I've been a nurse practitioner